performing certain lifting moves like either sumo squats, some deadlifts, or just weighted squats in general, you're noticing a lot of kind of like low back discomfort and really wondering why it's kind of manifesting. So I kind of wanted to address some really great stretches that you can do, especially since some of you guys are actually going to the gym to do the weightlifting, because it requires obviously heavier plates unless you do have the adequate equipment at home. So what I wanted to talk about was essentially is the reason why you're getting the back pain is because it's a repetitive action, okay? So if I'm you and I'm here in my deadlift position and I have my feet turned out and I'm gonna go ahead and I'm gonna come down with the bar and I'm in this position and I'm going ahead and I'm coming up out of the position, there's a tendency when we do repetitive motions, and I'm gonna show you what not to do. When you're coming down, there's a tendency to either try to scoop the back in terms of rounding, or what you do is you start leading with the butt more versus actually keeping that butt tucked under and coming up and kind of thrusting the hips forward as you make that end position. So what happens here is, the reason why the low back starts to get aggravated is because of the tilt that's going on at the pelvis level. So we always talk about trying to keep a neutral pelvis, which really engages the core. When we have a little bit of what's called an anterior tilt, where the actual pelvis starts kind of rocking forward, there's a greater tendency for our hip flexors to get involved, especially our iliopsoas and our psoas muscle, but also very posterior along the back side is our QL. So that can also get very stretched. Or what can happen is you can notice that one side of the body is actually kind of also rotating and stretching out at the same time, allowing for one side to be a little bit more dominant. So what I wanted to do, like I said, is take you through some really great stretches that you can do while you're at the gym. And if you do have a TRX at home, this you can do at home as well. They do involve the TRX. If you're unfamiliar with the TRX, real quick, usually at gyms, you're gonna see it's a yellow and black straps, unless you're using kind of a knockoff version of the TRX, which might be like red and black. So what I wanna do here is, we're gonna go through, like I said, some stretches that you can do with the TRX. So the first one that I really like to do is what's called a core extension. So you're gonna go ahead, you're gonna come without the straps being twisted. I'm going to show you on a slight angle so you can see nicely. So here I am, my arms are straight out. I'm pretty much standing straight up. What I'm going to do now is I'm going to go ahead, come right up onto the toes as if I was falling off a building, allowing for the whole entire back wall of my body to be stretched out. This is a really great one just to get some mobility going and some nice flexibility along the posterior chain of our body, which is all the musculature is on the back side. Now, granted, you're not going to feel this specifically in your QL or in your psoas, but like I said, it's a really nice stretch to kind of just get started and warm up. The other thing we want to address as well, just so we don't over-engage our hip flexors or our QL and put more strain on our low back, is scapular range of motion, which I've talked about before when looking at biomechanics and understanding that relationship between, the glenohumeral joint, which is your actual ball and socket joint, and the scapula. So what we're going to do is we're going to come all the way out so that we're standing up nice and tall. This is a great scapular stretch to allow us to really feel like we're stretching out everything along the back side of us. We're going to come here nice and tall, stretch the arms up. Then we're going to drop one arm without rotating the torso. We're going to stretch up again, feeling that right scap really elevate up. And then we're going to lean over. And you may feel a little bit of tingling in the fingers. That's totally normal and fine. But then we're going to come back up and we're going to go ahead and we're going to reach up nice and tall again. And then what we're going to do is we're going to alternate with this one. And we're going to reach up again, big and tall here. I like to do this one 3 times to each side. Again, it's a nice one to do right before we start lifting, just because it does allow for that scapular range of motion to really kind of now get into play. So this way, when we go and do our lifts, our lats actually engage, which will help with depression of those shoulder blades, which is crucial with your lift as well. Okay, so right there, we have two nice ones that you can do. So you have a core extension, and then you have a nice scapular stretch as well. This one is more for the psoas and the iliopsoas and will require a little bit more coordination and good form. So I'm going to show it to you guys stepping forward actually with my left leg, just so you can see via the camera. So from here, I'm going to go ahead and I'm going to have my arms essentially parallel to the floor. I'm going to take a nice big lunge step out, and as you can see, I'm almost going into like a sun salutation position. Right here off the bat, I give myself a little bit of hyperextension, but what I'm really trying to do is focus on pushing the hips forward. I'm not trying to have my butt back. I'm actually trying to push the hips themselves forward without allowing additional pressure on my front knee. As you can see, my front knee is at a nice 90-degree angle, and also right now I'm getting a nice stretch in my quad going up into my hip flexor area, so my psoas and my iliopsoas. This does require a lot of balance as well. So I go ahead and I reach those arms up nice and tall. From here, I'm going to drop my left arm, and then I'm going to stretch up again, and then I'm going to lean over to that side, really allowing for that stretch to happen. And then I'm going to come back, and I'm going to press into those straps, and I'm going to come back up. This one you would want to do about 5 times to each side. So again, here it is, stepping out, hold that position, drop the arm, reach up, and then kind of come over with a nice lean. Do not rotate the body, do not look towards that left arm. My eyes stay focused in front of me. I come back, I press into the straps, and I come back up. When you press into the straps and you come back up, you should notice also too some nice core engagement going on. Now, the next ones I'm going to show you involve us actually getting down a little bit more onto the ground. So if you're unfamiliar with the straps, just know you're going to go ahead, you're going to lower them down. So it does, both foot cradles come to about a mid-calf height, okay? So just about here. What we're going to do is we're going to overlay the two straps themselves. We're going to come down because now we're going to put a foot into the straps, okay? So from here, I'm going to go ahead, I'm going to come down, I'm going to put my feet into the straps, I'm going to roll myself over, and now I'm on a kneeling position, okay? So right off the bat, the straps now are going to allow for some nice resistance to apply some additional stretch that we may not get when we're just doing some active stretching ourselves. So from here, we're going to step out, and again, I'm mimicking that lunge position I just was in a very active pose. Now I'm going to be here. My knee again is at 90 degrees in the front. I'm focused on keeping my hips actually kind of tucked under. So now I have a great stretch going on here at the quad, okay? So from here, if you have that range of motion, which I do not, you can go ahead, bring the arms up and try to lean back and grab the straps behind you. Fortunately, I have very little lumbar mobility, so I can't go all the way back. But for those that can, the idea is to try to reach back, grab the straps without extending that front leg, keeping the position that you have it in. So from here, what we're going to do is we're going to reach those arms up. We're going to repeat what we did where we leaned over to that left side of the body, allowing that stretch to happen. Now here's the second part we're going to do. We're going to go ahead and we're going to place our hands so that the thumbs meet inside our leg, okay, inside that left leg. Then what we're going to do is we're going to extend that right leg straight back, allowing for that back to be nice and flat. Now we have some really great stretching going on here throughout the groin and the inner thigh, and a little bit with the hamstring as well. So this is another great stretch that you can do for your hip flexor and your iliopsoas as well. So these are the things that are going to start making that low back feel really great. The other activity that you guys can do is really crucial, is soft tissue work, okay? So I mentioned probably in a couple of posts a while back, talking about the fact that, breaking down the tissue will help enhance flexibility and mobility, and is really essential with those lifts. So what I want to talk to you about is just how you would use a massage ball, a lacrosse ball, or a tennis ball to your QL. If you don't know where your QL is, the simplest way to find the QL is to place both fists on the back side of you, right where that low back is. So from here, what we would do is we would take the lacrosse ball, place it such so we're hitting a high, a mid, and a low point, and we're allowing ourselves to kind of really work out that tissue. So what you would do is place the ball behind you, lay on the ball, and then you would go ahead and just enjoy that trigger point therapy. So that's how I would actually address the QL. For those that are experiencing, some low back discomfort, maybe some sciatica flare-up, but it's not really being triggered from the piriformis, but it's actually being triggered from a little bit more anterior tilt in the pelvis when you're lifting, and the fact that, as you're doing the repetitive motion, other muscle groups are engaging that shouldn't really be working. So like I said, guys, those are some really nice basic stretches you can do with the TRX to really address the low back, the hip flexors, and we'll start to get into the QL as well. And like I said, using that massage ball will be crucial for releasing that QL as well. If you have any more questions, always just ask. Here to help. As always, this is just Dr. Heather.